Hi, this is Amber Parrott from Morgan James Publishing, and today I have the honor of interviewing Dr. Jessica Way, the author of Physician Care for Thyself. Dr. Jessica, thank you for joining me today.
Here's the book.
I love
Oh,
it.
it's a pleasure to be here today with you.
I am so glad. I want to dive in and ask you a couple of questions about your new release. So, why did you feel compelled to share your story and write Physician Care for Thyself?
So I felt very compelled to write this. If you had asked me a few years ago, was I going to write a book about my experience of burnout and depression as a physician, I'd say, no, I don't think so. However, I began to realize that many of us as physicians and other healthcare providers are actually really struggling and suffering in silence.
Mm,
Especially during this time in the pandemic where there's so much pressure on our healthcare system today. Even before this came along, which this is a really huge challenge for all of us, there's not one of us that's not affected by this. Physicians and nurses and other healthcare providers were already on the edge of burnout anyway because of the way that healthcare is delivered in the United States and how doctors are trained as residents. And so I have my own personal story of burnout and depression. And I decided that I was going to have the courage to tell that story because now on the other side of that story, I'm living a life of greater freedom and joy and happiness. And I think the most powerful thing we can do is to tell our stories, especially when we're able to overcome great difficulty.
yeah,
So that's really why I felt so compelled. And within my story, there are parts that maybe I wasn't going to tell anybody in the
sure.
world about, like, how much I suffered with depression, my own personal experience with conventional psychiatry, my having a complication from medication and then ending up being hospitalized because
Mm,
I was having recurrent feelings that I didn't want to be here and that I wanted to take my own life. And then a subsequent realization because of another complication of medication. So I would say there's a couple of things, two components to this book in terms of telling the story. Number one is that my personal journey
mm,
through becoming very overwhelmed as an obstetrician gynecologist, which, by the way, I loved my job. It's not that I didn't love my job. I
yeah,
really felt so privileged to deliver babies and to be taking care of women every day. Oh my goodness, what a privilege. And at the same time, there were a lot of pressures. I wasn't sleeping well. I wasn't taking care of myself very well because I didn't feel like I had room to do that. And for me, that showed up in terms of illness as emotional illness, as depression, and becoming more and more tired and fatigued. And it becomes a cycle where when you're feeling really bad, you really aren't in a place to really care for yourself well. And
yeah,
then your sleep gets more disrupted. Especially as an obstetrician, waiting for those babies to be delivered in the middle of the
right.
night. What a privilege and also what a strain on a human being to have to kind of be on alert all the time.
Yeah.
So there's that aspect of the personal story of the choices that I made, which one of the choices was I did choose to leave my job as an OBGYN 4.5 years ago. And part of that journey was the second aspect of the book, which is that healthcare in the United States is not working well. People are actually
Mm,
getting more and more sick. And as someone who was in the conventional care system for my particular problems, I saw how clearly I wasn't being helped despite going to very well intended physicians.
yeah,
And so I had to be curious about my own path and how was I going to lift myself out of this?
sure.
And how was I going to take better care of my patients too? Because I noticed my patients also year after year were getting more and more, they're getting heavier, they're getting more unhappy with their life, they're getting whatever was going on, more
Yeah.
tired, and all the slew of gynecologic issues that they came in with. And I thought, there's got to be a different way. So I completed a fellowship in integrative medicine and now I'm certified in something called functional medicine.
Mm,
And I used all of that to help me regain my mental health, my clarity, my physical health, and help me make decisions and to have the courage to move forward in a different way and
Yeah.
to understand I had the freedom and power to do that.
Yeah.
But I was only able to do that once I kind of collected myself and was able to feel better and have more energy. Because one
Yeah.
of the problems when you're in burnout, you don't feel like you have any choices. You don't feel like you have energy to think differently.
Yeah.
And so, again, two aspects. There's my own personal story, but then there's also this aspect of conventional care doesn't always meet us where we need.
Right.
So, for me, practicing functional medicine, integrative medicine is a much more powerful way for us to bring our bodies into alignment the way and to for them to work in the way they're intended to,
Yeah.
including our minds. And that gives us so much more leverage and ability to create the life we really, really want.
Yeah.
And that's what this book is about.
Love that. I love that you pull both from, your own personal experience, which thank you so much for being willing to share some of those moments. I think, like you said, in burnouts, you can feel so stuck when you're burnt out, and just to have somebody say, "I've been there, and it took a little bit, but I got out of it, and this is how." That is so powerful. So thank you so much for being willing to share that.
Of course, if I always say to myself, if the book helps one other human being, then it's
Yeah.
worth writing.
Yeah. Absolutely. I love that perspective. So, what
Mhm.
guidance do you provide in your book for physicians who are feeling burned out?
I will say, number one, that I am not going to say that by any means is it easy, and I'm not going to be Pollyanna and say, oh, just do this and you're going to feel better. It's
Sure.
not that simple. It starts with having some curiosity and
Mhm.
understanding that you can get there. And even that can be challenging at times,
Yeah,
especially if you're burned out and you're dealing with depression and anxiety. There needs to be some ability to slow down at some point in your, maybe it's in your week, maybe it's
sure.
not daily at first because you're feeling pretty hemmed in by all of the responsibilities, especially if you are a mother
Mm.
and a
Yeah.
physician. For a long while, my kids are older now. My two sons are 16, 17, so it's kind of easy now. They're like, they're able to lead their own lives and care. I mean, I still am their mom and I still need to do things for them, but it's not like when they were younger.
Sure.
But to find some space in your life, and again, it might be the day that you have a day off, to just sit and be quiet and to kind of imagine, well, if this isn't the life I want to lead, what is the life that I want to lead? And just start thinking about that as a possibility.
Yeah.
Just start there first. I think the next step really is to really actually to start taking care of the physical body, which I think we talk about a lot. We say we pay lip service to, okay, we need to eat well, we need to move, we need to meditate and all this, but it's like you have to do it. You
Right.
really have to do it. And so, and then I would say that, I mean, in this book, I have a chapter in which I go through the functional medicine approach to, these symptoms of fatigue and depression and things like that, and talking about getting our gut health aligned and everything aligned. And so, it's a start in the book, but what I would really say is that if someone really feels like they need help getting their physical health back, to go to a functional medicine, integrative medicine physician to help them guide them on that journey.
Yeah.
And then you are going to feel more energy. You're going to feel more you just feel better.
Yeah.
And one of two things will happen. You'll kind of just stay where you are and feel like, yeah, I'm good and I'm feeling good enough. And I was there for a while. I'm like, I feel good enough to continue to do this. Or you might have some space, some bandwidth to think, hmm, am I really doing what I originally intended in this job? Am I really helping people in the way that I intended? And to just keep that contemplation going. And
Yeah.
again, this can take many years. It took me many years. And then to have the wherewithal and energy to say, hey, maybe I can make a different decision. And again, takes time, takes courage, takes lots of, you know, I guess preparation.
Sure.
Um, but in terms of the doctor who's out there who's feeling burnout, it's number one, create space for yourself.
Yeah.
Find ways to get your physical body and physiology working the way it's intended to work.
Yeah.
Then have greater mental clarity and energy. Then decide, is this the life I want to be leading? And realize in every moment we have choices.
Yeah.
We are free in every moment, even though sometimes we don't feel that way. The truth is, we are.
Right.
So
I love it. And I love that, you encourage physicians to start by getting themselves squared away enough to make clear decisions. And I think that's really beneficial for making sure that when you do make a decision, you know that it's from a place of health.
that's right.
I love
That's
it.
right.
So, Jessica, tell us why physician burnout is a problem for all of us.
That's a great question. So I would answer that on, again, on two levels. So I know that when I was in my conventional practice as an OBGYN, I started to notice, although even when I was feeling pretty tired and burned out, I still gave my full attention and presence to my patients. And I write about this a little bit in the book, I began to like more and more narrow like bandwidth for anything that was kind of outside of like my immediate art, like I was about to use the word arsenal, but my immediate toolbox, right, of answers. If it fell outside of that, I would kind of, I would listen and hear, but in my head, I'd be like, all right, I don't have an answer for that, and I need to move on because I have 25 more patients to see.
Right.
And this is the place where many physicians find themselves. And I think everybody's doing the best that they can. However, what I discovered was when I moved into my functional medicine practice and I created more time for patients, for people who came to me to talk, time and time and time again, they said, well, why? First of all, my doctor never asked me about these things. My
Mm,
doctor didn't really seem to care.
sure.
And they always seemed like they just wanted to get out the door. And I said, well, that's kind of the way the system is designed.
Yeah.
And it's not that your physician didn't care about you, it's just that they didn't have time and they didn't have bandwidth.
Right.
So, on a patient level, physician burnout is a problem because people are not getting the care that they need, and so that's why physician burnout is a problem for all of us. But then, kind of the second tier really is this whole system of healthcare. It's really beginning to break down. I mean, healthcare costs are increasing, and but people's health isn't necessarily getting better. People's, the cost and the personal cost and then actual financial cost to people in terms of their health is just rising. And part of that is because, okay, so maybe physicians don't have bandwidth to kind of see things in a holistic way and treat, because the system's not designed that way, right? There's not enough time. And so the other thing is that with physician burnout is you're going to have, and this is happening already. There was an article in the New York Times 5 days ago about how more and more physicians are actually not able to practice anymore
Mhm.
because this is part of it's because of the pandemic and financial pressures, but
Yeah.
it's the number of physicians and other healthcare providers like APRNs and physician assistants there's going to be a trend where number one, not as many people are going number of people doing is going to start shrinking. So people's access to care, which is already compromised, is going to become even more compromised. So
Right.
number one, if you get into your doctor may or may not have the bandwidth to address the complexity of the problem you're facing. And then number two, with physician burnout and attrition of the number of providers, people may not even have access to a doctor. I
Mm,
mean, these are things that are more of a systemic problem,
sure.
but it's something we really need to start paying attention to and approach from a systems, kind of from a political and public policy standpoint, because we don't think it's going to be a problem, but it's already a problem for people,
Yeah.
access, and then the quality of their interaction with their physician. So physician burnout is a problem for every single one of us, not just for the physician themselves. It's for
Yeah.
we as who need care, and then just globally what the healthcare system is going to look like in the coming years.
Yeah, yeah, that's so true. It's crazy how, physicians take care of health and everybody needs their health to be able to function in society. So it really does impact
Yes.
everyone. Yeah, yeah. Well, thank you so much. I want to ask before we wrap up, if viewers at home want to get connected with you, where can they find you?
So the best way to reach me is through my email address. There, if they just want to share a story or they want to reach out and talk, I'm here to listen.
Awesome. Thank you so much, Dr. Way, and congratulations on the release of your book, Viewers at Home.
Thank you
Thank you.
so much.
Yeah, absolutely. Such a beautiful cover. I love that color. Viewers at home, thank you for joining, and be sure to check out Physician Care for Thyself wherever books are sold.
Thank you very much, Amber. It's been a pleasure.